Dr. John Viviano has been providing conservative therapy for sleep disorder breathing and nocturnal bruxism, commonly referred to as snoring, sleep apnea, and tooth grinding for many years. Here are some testimonials from real patients.
I first came to have my teeth done, and it was at that time that I saw your sign about the sleep apnea appliance.
Okay. And were you being treated at that time for sleep apnea?
Yes, I was using a CPAP machine. Had been using it for about 2 years, but I was having some extreme difficulties with it in the last several months.
Okay. So we had a consultation about the possibility of using an oral appliance.
That's right.
And how has that been?
It's been absolutely amazing. In comparison, I was having so much trouble with the CPAP. My sinuses were really bothering me, and with this I was able to use it without any disruption of my sinuses. As well, I did a lot of traveling at that time, and I couldn't use a CPAP on the plane, and when I was traveling to China, I wouldn't be able to sleep for the entire flight. So with the appliance, I was able to sleep. It's excellent. It's a very small, lightweight appliance that it just molds to your teeth. It's quite easy to insert and easy to use.
Good. Well, thank you very much for sharing with us today.
You're welcome.
And what did we do for you?
Basically, you explained the process very thoroughly to me in terms of how the dental device might work and why the airways are blocked and how the dental device moves your jaw slightly forward in a comfortable way, and consulted with me on the type of device that I was most suited for, and had an impression done, sent away, and I came back for a fitting for my dental device.
And how's it going?
It's been awesome. It's been life-changing. I have way more energy, I sleep better. Of course, my wife is much happier with me, not snoring, and it's something that I would recommend very strongly people investigate any sleep apnea they may think they have, and certainly investigate the dental device as part of a solution to that.
Actually, I wasn't referred at all. When I conducted a sleep study and found out that I had a problem with sleeping, nobody even mentioned an oral appliance as being an option. So I did some research of my own, and found you. The process was great. You were very clear about explaining everything to me, what the pros and cons were, what some of my options were, and that you know, with the type of apnea that I had, this could work, or as well as CPAP. You were very open that there were other options aside from the oral appliance, but I decided I wanted to pursue this one.
At the end of the process, we did an at-home sleep study to see how well the appliance was working for you. How did you find that?
That was great, yeah. I mean, anytime you've got things wired to you, you're never going to have a great night's sleep, but it was certainly a lot easier than the full sleep study that I had. And you got the information that you needed and compared it to my original results, so it showed that it was successful. And I was quite surprised that it happened as early on in the process as it did. It's only really been a couple of months since I got the appliance, and part of that was because I was away on vacation. So really, it's been resolved very, very quickly.
And what would you recommend for others in your situation?
I'd say the big thing is to do some research on your own. At no point did my family doctor or the sleep physician that ran the sleep clinic mention an oral appliance as an option, so I was quite pleased that this was a recognized option, and it's been quite successful. I'm really pleased with how this has turned out.
To schedule your consultation for sleep disorder breathing, please call 905-607-3777.